All right, there we go. So it looks like we are live, but you may in fact be watching this on a playback, and that's fine as well. But this is Princess Akima. I there we are live. All right, I should have turned my speaker off, but that's what you get with the live video that you won't get with all the pre-recorded perfect edits. Nothing about this page is perfect except my intention towards patients and supporting those who are walking through chronic illness and who are, navigating this life. I definitely want to continue to thank you all who have subscribed to this channel, who have been like turning on the bell so that you know when I am live. And messages are visible. Okay, perfect. And so, as you can see from the title of this video, I wanted to talk through what I wish every practitioner knew about complex patients. What makes a patient complex, or what, someone might think is complex, is like when we lack an understanding, right? So I don't know what's going on. I don't know what's happening. It's not so black and white. And we're so accustomed to like black and white, a need to know for it to be simple, because if it's this problem, then it's this solution, and then we can just kind of go about our business. But when we are walking through something that's a little bit in the gray, I think that becomes very challenging. And I definitely want you to know that if you are a individual, a patient, and you are suffering with a chronic illness, this is not to miss you in the conversation, but it's like something that I want the practitioners like myself, whether it's someone like me who works in Eastern medicine, or whether it's someone who works in another field of medicine. I think that there are lots of components for us to explore. If you've never considered it, like use this as your opportunity to consider it. Don't forget the emotional landscape of chronic illness. A lot of the um, a lot of the videos you'll see on here where I'm talking, I'm not just talking about, the germs and the bacteria, and I get it. They overeducate on those things. And currently, at least where I live, everyone is talking about um, what is the thing that they're dealing with, Lord? The parasites. It's just like all these things that are going on. And those are true things that can make someone not be well. But I would tell a practitioner who's trying to figure out, we don't know what's wrong, we're still trying to figure it out. I would say, please do not negate the emotions that have also lent themselves to the patient's um, illness, and how we need to address those things as well. I'm seeing a question that popped up is how you hold space with someone with a complex health issue. Something I heard from someone earlier today when I was doing a live discussion on another platform, they were saying that they were sick of people blaming them for their chronic illness. And so one of the ways we hold space for someone is like we do play a role in the condition of our health, but we are not the totality of our health, if that makes sense. And so when someone has, factors that are beyond their control, whether it's genetics and DNA, or whether they've come into something environmentally, I think that would be one of the things. And I think that practitioners have a beautiful opportunity to not make their patients feel like, even lower when they are walking through those things. So that would be something that I'd say for sure needs to be something that's considered when we're thinking about the quote complex patient cases. Something else that I would, suggest and caution is like why the standard protocols fail. I think we have to remember that we're looking at a human being, and we're not looking at a book. Case studies are great, like, oh, here's a case study. Sometimes they're based upon a previous, patient case, and sometimes they're fictitious. And I think that those are great in helping us to learn, how if we do see this pattern show up, what it can do for us. What I would caution a practitioner against is it's never they presented like this with these symptoms. It's got to be this diagnosis. It's got to be this solution because you miss the human component in that. And I'll tell you right now, especially with a lot of like, doctors choosing to go concierge, or for those of us who are in Eastern medicine, we're all vying for someone's attention. People want that personal touch. I know that's something that has helped patients to stay with me for years, is because they with maintaining every ethical boundary, they feel like family. They feel heard, they feel seen, they feel cared for. They feel like we are exploring all the solutions. They don't feel blamed. They feel like a partner in their health. And so the standard protocols are going to keep failing when you keep treating people like all the same. So that's the next thing that I would say and caution a practitioner against. Building trust with your patients. And although people will say in relationships like, oh, well, it takes time to build trust. Yeah, it can take time to build trust. But again, I don't think that that is like standard across the line, because you can build trust by the way you listen, the way you repeat back, the time you take with people. One thing I know my patients have always been surprised is during their first appointment, it's 90 minutes, and you can hear the anxiety and the desire to speak so fast. And then I'm like, okay, did you want to say anything more? Was there something more there? I have a question about this. I wanted to explore this more. And there's almost this like, oh, and then you'll see like their face relax, their shoulders relax, their breathing starts to change. You can build trust by just how you're dealing with people, the tone of your voice. We're not exercising the power differential. We're not playing on people's fears of white coat syndrome, you know, exploring that with your patients, reading their body language and making the adjustments. Those can happen during the first patient appointment. Those can happen even by the way you lay out your website, to be honest with you, and even the way that you handle your social media or any touch points that you have with a patient or a potential patient. You're building trust the entire time. And so it's not just this one way. I know for me, because if people are like, well, how does this work? I mean, I just tell you, like, go to Google and look up Princess Akima Holistic Care. Go on my website and look at testimonials. And I'm not saying that I got it down on lock. I will say that I've got a lot of it on lock because there is no practitioner without the patient. And so the appeal that I would make to you all who are listening to this, who are, patients, is don't remember that you have space and opportunity to help teach your practitioner. So even if you feel like something isn't happening for you in the space, you don't have to just complain about that like after you're gone and after you get out, like, oh, I didn't like how they did, insert behavior that they did. In the moment, you can assert yourself and you don't have to be rude. You're a chronic illness sufferer who has low energy. You don't have to, oh, you're very welcome. They were just saying that they love the answer and insight. I think YouTube leaves the comments up in case they don't. You're very welcome. But you can assert yourself into that because no matter what a person knows who is attempting to treat you, you know your body more than anyone. You may not fully understand why all the things are happening to you at this moment, and you might be tired, you might be frustrated, but you do know yourself, and you are able to speak in a way and command a level of not a level of respect, because it's not like respect versus disrespect, but like, I want to be heard. So let me repeat that again. I feel like I'm being rushed. So can we slow this appointment down? It's okay to say these things. I've had patients say to me, like, oh man, Princess, I wish you could come to me on my appointments. And like, no, I'm not going to be able to come. You can always bring a patient advocate in, a spouse or a partner, a parent, a friend, someone who is an unpaid support in your life for sure can go with you and be that support with you. What I do want you to remember about me is like something is happening in this appointment. And I remember Princess Akima saying, I need to take control and command of this room, because these are things that I wish every practitioner knew about complex patient cases. but they might not watch this video. And I'm sure that I probably have more patients and potential patients who are subscribed to this channel than practitioners. And that's fine. Someone's going to probably think I'm not a practitioner worth listening to, depending upon what letters they have. So if I'm making this appeal to the chronic illness sufferer or for the caregiver, is assert your position in those treatment rooms so that you yourself or the chronic illness sufferer who's depending upon you can be served. So these are things that I want practitioners to know. They're going to learn by being more empathetic and sympathetic, and they're going to also learn by what you say, share, and assert in those spaces. So you guys know I don't keep these very long, and YouTube is phenomenal about keeping them up. Again, if you watch this video and you feel like, oh, I want to hear more from her, please make sure you subscribe to the channel. Please make sure you hit the bell so you get notified when I go live. And okay, one more question. I'll answer this before I get off. Sorry, I'm giving you all the end of video things. What are some ways you would be of service for a chronic illness sufferer? Um, Come see me, once you have gone to your physical and the blood work is saying this and the diagnosing is saying that, you add additional, players to your team. So where I come in is like, let me come in. Invite me to have a seat at the table as it relates to your health and wellness so we can talk about things that we can add on, so we can talk about alternatives, so we can talk about treatment planning around what's going on with you, because there is no one way to solve a problem. And I don't care what anybody's telling you. I know they're like, nah, Kim, they said I had to do this. I must do this. Sometimes they're telling us that we're going to be unalived if I don't do this. And I'm sorry. I really am sorry about that level of fear communication. My response to the question of what I can do and be of service to you is you make an appointment with me, because now you have something going on. Because if it's not going to be me, I am never afraid to refer out to someone who I think could handle your case, even if it isn't me. So my thing is, let's at least have a conversation so we can talk through the things. And no, I didn't consider that deep. I think as we're talking about complex cases, you people may feel like I am a complex case. Now, what do I do? You add more players to the team, because with a multitude of counsel, right? There's wisdom in that. And we can apply that even with our health and wellness. That's not just for, other life decisions. That can even be applied here in these health and wellness spaces. So on that note, as a reminder, please subscribe to the channel. Please hit the bell. I do try to go live here once, sometimes twice a week. And if you comment on any of my videos, I myself come and respond to those, even if it takes me some time. It's not a bot, it's not an assistant. I do try to come myself and respond to those. So please feel free to leave your comments and your questions. And I will see you guys and gals the next